Gondusky. I'm going to talk to you a little bit about what to expect during the day of the surgery so you can prepare. In the morning, you'll generally shower and comply with the facility NPO or nothing by mouth policy. This is a typical one for most patients from an NPO standpoint. So we have a HIBA protocol, which basically has you shower with HIBA the night of and morning of the surgery. And then no solids or clear liquids after midnight the day before the surgery, except for clear liquids are permitted 4 hours before surgery start time. Again, this can change between facilities, but for the most part, this is a pretty common one for me. Just make sure you check with your facility to make sure you have the right policy. The facility usually sometime between early morning and late morning. You'll show up usually with your coach or your driver. Your show time will be given to you a day or more before the surgery day. So a lot of patients want to kind of know this as soon as they can. It is sometimes a little tough really to give that way ahead of time because the OR is such a busy place. There's a lot of emergent and non-emergent things going on. And so telling people exactly when to show up for showtime, generally we can give a range to, but really it gets confirmed 1 or more days out from the actual day of the surgery. And then you're going to check in, you'll be brought back to the preoperative area after some paperwork is filled out. The facility usually sometime between early morning and late morning. You'll show up usually with your coach or your driver. Your show time will be given to you a day or more before the surgery day. Also in the preoperative area while you're waiting, you'll meet your anesthesia team. They'll discuss the type of anesthesia that is best for you. In general, I prefer and we prefer local or spinal anesthetics with IV sedation. There's reasons for this, including outcomes which are better with lower risk and overall ability to get up and walk and ambulate with therapy, which tends to be better. So those are the preferred anesthetic type in most patients, and your anesthesia and I will talk to you about that. And then me or your surgeon will come see you, and we will sign the extremity that we're going to operate on and answer any final questions about things you have before surgery, and talk to your ride and make sure everybody's on the same page with your medicines after surgery. We'll make sure that the therapy is set up after surgery, and we'll make sure you understand everything that's about to happen. In the operating room, you will be comfortable. I always tell people we could not do the surgery if you were not comfortable. So we will make sure that you are comfortable and can't feel pain and can't hear anything and can't see anything. And you are most commonly snoozing and taking a nap. Most standard joint replacements take about an hour of actual surgical time, and then about another 30 to 60 minutes are needed for anesthesia, positioning, and preparation. So usually this totals about 2 hours in the operating room, and then you'll move to the recovery area. Sometimes you'll go home right from this recovery area. Other times you'll be transferred to a different short stay area, and then use that area to get up and walk and do your therapy with, and then go home. After surgery in the recovery area, which will be about an hour and a half to 2.5 hours, you'll basically get everything ready to go home. We want to see all the discharge criteria, meaning that we want you to have good, stable vital signs. We want you to be comfortable with minimal to no pain. We want you to be able to urinate. We want you to be able to eat. We want you to pass your therapy test. And, it's surprising to people, but you will be up and walking right away, immediately after surgery. Within an hour or so after surgery, you'll be able to walk on the extremity, put full weight on it, and walk. Everybody does start with a walker because it's the most stable thing, and it's not necessary from a weight bearing standpoint. It's really just for a stability thing. After anesthesia and starting out after surgery, we give you a walker because it is the most stable thing to prevent falls, and that's really what everybody starts on. Transitioning to a cane afterwards, usually pretty quickly, and pretty limited use of walkers for the most part. But we do start with those. And look at this patient. You will be able to walk up and down a small set of stairs hours after surgery. So we will practice these with you, mostly from a comfort standpoint. We want to make sure you know how to get up and down a set of stairs, and also just to make sure you're comfortable with that, because that's a common question that patients have. They have stairs to get into the house, and they want to make sure that they're comfortable to do that. So we'll practice before you go. So before we go, we'll make sure you meet those discharge criteria, and we'll also make sure you have